So artificial intelligence is already here. It's in our hospitals, recommending treatments, predicting outcomes, and even prioritizing patient care. Now, this is a massive leap forward, for sure, but it forces us to ask a really critical question. When a decision that's been supported by an AI leads to a bad outcome, who actually carries the weight of that responsibility? This is, without a doubt, one of the most pressing ethical challenges in modern nursing, and today, we're going to break it all down.
First up, let's just look at what the technology itself has to say about all this. What's the machine's perspective on who's responsible? The AI's position is, well, it's logical, it's clean, and it's very direct.
The AI stance is crystal clear. It basically says, look, my role is strictly to be a supportive tool. It's not making the final call, it's just providing data to the human who is.
So from the machine's point of view, accountability rests squarely with the human operators, the clinicians, and of course the healthcare organizations that put these systems in place. It's a simple, clear-cut handoff of responsibility. But is it really that simple in practice?
Okay, let's flip over to the other side of this equation. Because when you step away from the clean logic of the algorithm and onto the actual hospital floor, the reality for nurses is, well, it's a whole lot more complex.
This quote right here really gets to the heart of it. For nurses, clinical judgment isn't just a choice. It's a professional obligation. It's tied directly to their license. They are required to use their expertise, regardless of what a machine might be suggesting.
And we're not talking about just a gut feeling. Nursing judgment is a rigorous, methodical process. Nurses are trained to constantly assess a patient, intervene, and then evaluate the outcome. It's this dynamic, human-centered loop. And it's fundamentally at odds with blindly trusting a static recommendation, because a critical part of that process is to question any data, including from an AI, that doesn't match what they're seeing with their own eyes.
So while an AI might provide a recommendation, the nurse has to interpret it, they have to question it, and sometimes, for the patient's own safety, they have to completely override it. They just don't have the option to pass the responsibility over to the machine.
And this is where we find the central conflict. How do you trust a powerful new tool without surrendering the very human judgment that is the absolute bedrock of safe patient care?
Here's the core of the dilemma, right? The algorithm, it sees probabilities. It's analyzing huge amounts of historical data, looking for patterns. But the nurse sees a single patient, an individual with unique circumstances, subtle little changes, and personal values that you're just not going to find in a data set.
This is the active, ethical work that's happening in real time. Before acting on an AI suggestion, a nurse is ethically bound to run it through these critical filters. It's a process of discernment that technology, at least for now, simply cannot do.
Ultimately, the real takeaway here is that ethical decision-making is a fundamentally human act. It happens inside that relationship between a caregiver and a patient, right there at the bedside.
But it's not really fair to place this entire ethical burden solely on the individual nurse. Accountability has to be a shared organizational responsibility.
For nurses to be able to use AI safely and effectively, the healthcare system has to provide this kind of foundation. The tools themselves need to be transparent and thoroughly tested. The staff needs ongoing education. And maybe most importantly, you have to create a culture of psychological safety, where nurses feel empowered to question the technology without being afraid of blame.
You just can't hold nurses accountable for AI-driven outcomes if they don't have the ultimate authority and the organizational support to make the final judgment. It's an unfair and frankly unethical position to put them in.
So as we wrap up this explainer, the conclusion becomes pretty clear. AI can be a powerful assistant, a great co-pilot, but it cannot be the moral captain of the ship. That moral agency, it remains fundamentally human.
The technology is a support structure, absolutely. But the nurse, grounded in professional standards and human judgment, remains the one who is accountable for the care that's actually delivered.
And this leaves us with a final provocative question for the future. As these tools become more and more integrated into healthcare, what's the right balance? Do we train our next generation of nurses primarily to trust the data, or do we train them first and foremost to challenge it? The answer is going to define the future of care.